Hi everyone, I am going to start doing a series on guess that diagnosis, and what I'm going to do is I'm going to start with just a general statement, and then we'll have lots of different diagnoses down here to pick from that may have similar signs and symptoms but not exactly the same, and then I'll give you hints as we go along, and of course I'll give the exact answer at the end of this video, so stay tuned for that. So let's begin. Patient has left-sided abdominal pain with nausea and vomiting. You see some choices here: diverticulitis, appendicitis, pancreatitis, colitis, IBS, cholecystitis, and peptic ulcer disease. Which one right away do you think that it is? If you already know, go ahead and comment in the comment section based on this information. Is there any diagnosis below that you could take off this list? So one key thing that it's talking about here is left abdominal pain. So when you go through these, you can already start looking at which ones tend to be on which side of the abdomen or the other. And so I made a little chart here, just a real brief chart of each one. It didn't go into a whole lot of details, but diverticulitis tends to be on the left, appendicitis tends to be on the right, pancreatitis tends to be on the left, colitis on the left, IBS is kind of generalized in the middle a lot of times, cholecystitis on the right side, peptic ulcer disease, epigastric area. So this is just a generalization. This is not always the case for every single one. I personally had appendicitis and mine started on the left side and then ended up moving over to the right side. This helps to take some of these things off of our list, and so let's cut our list down. Right away we're going to take appendicitis off the list. So let's go over appendicitis briefly. Appendicitis usually has right lower quadrant abdominal pain. It can develop suddenly, and often it may start middle of the abdomen and move over to the right lower quadrant in 1 to 12 hours. These individuals often have a positive psoas sign, obturator sign, and also rovsing. They also often have nausea and sometimes vomiting as well, and fever, and as far as labs, they often have an elevated WBC. Let's look at the list again and cross off another one from the list, and that would be cholecystitis. Often with cholecystitis, there is right-sided upper abdominal pain. There's also a positive Murphy sign. The pain may radiate to the right shoulder back area. These individuals may have fever and sometimes jaundice, although that is uncommon, and also nausea as well. As far as labs, they often have elevated WBCs and elevated liver enzymes. Let's move on. The next one to cross off of our list is IBS, irritable bowel syndrome. Let's talk a little bit about irritable bowel syndrome. It doesn't tend to have one side or the other of abdominal pain. Typically it's generalized and cramping in nature. Individuals don't have usually focal pinpoint pain that they talk about. It's usually just general. They may have diarrhea or constipation type. It just depends. If they have constipation, often defecation helps to relieve the abdominal pain. Stress and certain foods can rev up and flare the IBS. Let's move on to the next one to take off our list. The final one to take off the list before we move on to the next hint about which diagnosis this is that we're talking about. We're going to remove peptic ulcer disease, PUD, off of this list. It doesn't tend to have one side or the other pain. A lot of times these individuals will complain of epigastric pain or kind of in the middle of their abdomen. It's often relieved after eating. They may also complain of a dull sensation or a gnawing pain. They may have feelings of early fullness after eating. They may have a lot of bloating, belching, they're burping a lot, heartburn, nausea, and sometimes even vomiting. So now we don't have much left on our list as far as differential diagnoses to go over as far as this left-sided abdominal pain. So let's narrow it down even more. Let me give you another hint and let's see if we can cross more off of our list. In addition to left abdominal pain, they actually have left upper quadrant pain. In addition to this left upper quadrant pain, they're also having some left shoulder pain as well. Now, with diverticulitis, it tends to be the left lower quadrant, and colitis as well. Often we'll see pain more in that area, and it doesn't tend to radiate to the shoulder or the back area. Pancreatitis, however, does. Pancreatitis is our answer. So before I briefly go over pancreatitis, I want to go over these last two that we crossed off our list, starting with diverticulitis. Individuals with diverticulitis often have left lower quadrant abdominal pain, nausea and sometimes vomiting, constipation, and sometimes fever. Any type of fibrous foods when an individual is in an acute attack of the diverticulitis often can make things even worse. Colitis can have many different symptoms because there's many different causes for colitis, but often the individual will complain of left lower abdominal pain, a cramping sensation in the abdomen, loose stools, overall feeling just not well. They may have diarrhea, bloating, and even blood in their stools. Now, let's jump into the actual diagnosis here. Individuals with pancreatitis, often they'll have left upper quadrant pain instead of the left lower quadrant pain. In certain cases, although it's not very often, but this may indicate hemorrhagic pancreatitis, which is it's a pretty severe emergent condition. Pancreatitis itself is emergent, but these are definitely things that it's important to be watching for. It's Gray Turner, colon, and Fox sign. These individuals also have nausea and vomiting. That's actually very common, especially if they try to eat anything. They're going to throw it right back up. And because of this, they often have signs of dehydration. They may have skin tinting. They may have dry mucous membranes. These individuals just can't eat. They can't keep things down. They throw it up. These individuals often have a history of alcohol use, and so this is one. It's an extremely important question to ask when you're trying to determine, what the cause of the abdominal pain is before you've done any labs and/or test. Some labs that are often elevated with pancreatitis include lipase, amylase, and liver enzymes. I wanted to leave you or in this video basically with a list of questions that would be great to ask if you're a provider or nurse, or if you're in the medical field of some sorts. These are great questions to ask individuals who come in with abdominal pain. Each one of them kind of helps to rule different things off of your list. There's so many different causes of abdominal pain. One of the best questions to start with first is often, where is the abdominal pain? How often is it happening? Is this a recurrent issue? Are you having constipation, diarrhea? A lot of these questions will help roll out different differential diagnoses off your list. And so there's many more questions other than this, and there's many more diagnoses other than the ones listed in this video. Here are a bunch more that I typed up, so you can screenshot this if you want this as kind of like a differential diagnosis list. Of course, there are many other causes for abdominal pain than just these here, but this is a great list to kind of start marking things off quickly off your list of what could be going on. Thank you so much for watching, and please make sure to subscribe to our channel for more medical information, tips, tricks, hacks, great stuff for nurses, nurse practitioners, nursing students, anybody in the medical field. This is a very helpful channel for all sorts of medical topics, making medical topics easier to learn and remember. Also check us out on Facebook, on our Facebook page, and also TikTok, Instagram, and Pinterest. Until next time.